The next slide is recommendation 3, and I'm going to group recommendation 3 and recommendation 4 together because there's crossover between all the 4 recommendations that we talk about today, but particularly these two. And I'm not going to read them out entirely because you can see them, but this one is about meeting the needs of young mothers, so mothers under 20 years old, and making sure that there's adequate resources for them. And the next slide is recommendation 4, which talks about early identification of women with modifiable risk factors and equitable health care. And there is a list of those down there, such as pre-pregnancy care for known medical diseases, appropriate antenatal care. Preterm labour again comes up, evidence-based recommendations and advice and management for decreased fetal movements. Our next speaker is Violet Clapham. She continues to work incredibly hard with and for the community in which she lives. She's a coordinator of the Midwifery Resource Centre in Canterbury, which is a community-based service promoting access to continuity of midwifery care. Violet also practices as a home birth midwife in Ōtautahi and is currently completing her master's research project. She is strongly focused on improving equity of access to maternity care and services and developing innovative solutions together with the community to improve outcomes. So welcome, Violet, and thanks for joining us.
Tēnā koutou katoa. It's lovely to be here and be able to share a little bit with you about some work that we're doing in Waitaha to support young parents in our community. So if we just go to the first slide in my slideshow, just to give you a little bit of background, the Midwifery Resource Centre that I coordinate in our region has existed since the 1990s and for a very long time was a community drop-in service run voluntarily by midwives in our community. And that service just across the board offers free pregnancy testing service and information about how maternity services work, and increasingly over the last years has stepped into the space of navigation into LMC midwifery care. In 2017, there were discussions starting to happen around how we support young parents in our community here, with the recognition that we weren't always getting it right within that community, and we were seeing that in terms of outcomes from maternity care and further on into the parenting stage of things. So a working group got together and looked at what we could do. We also were aware that we had a rather sporadic approach to support services for young parents in our community. And we were wanting to know, how can we improve that? How can we make the systems work better to improve the support and access for young mama in our community? So out of that work stream, in 2018, we actually developed a program called Linkids, and that service acts as a centralised coordination and referral centre for young parents in our community. And as part of that work, the Midwifery Resource Centre was contracted to provide a very tailored and specific navigation and support services for young parents. So the next slide will just show you the referral form that is used to refer into the young parent support service. And what I think is important to note here is that the age that we're focusing on is young parents 19 years and under. And also just to note, the background information section on the form allows anybody that's making a referral into the service to identify those things that, when you take a more holistic view, might be significantly impacting well-being for those whānau. So if you're working with someone who happens to be hapu, but also is needing support around their alcohol and drug use, or they're having issues accessing a good housing option or transport, or they're needing social supports. All of those things are able to be identified in this collectivised referral form. And then you can also indicate the level of support that you think that whānau needs. So whether they're just at that lower level, or they're needing more intensive education and support, or they're needing quite strong continued support around their wellbeing. So what this contract has enabled us to do at the Midwifery Resource Centre, you will see on the next slide that we've identified that there are some specific things that really make a difference when we're working with these young mama and their whānau. And those really for us are focused around these key cultural concepts of whakapapa. So we take that time right at the very beginning of our contact with them to have an initial discussion about who they are, who is their whānau, what is it that they are going to need to support an individual care plan and to help them navigate their way into a satisfactory care arrangement through their maternity journey. Looking at whanaungatanga, often with these young mama, some of them are 13, 14 years old. This might be their very first interaction with the health service. They may or may not have engagement with primary care services, but often that's quite an intimidating thing for them to be in that role of the person receiving healthcare, to be asked questions about their wellbeing or their medical history. And we find that throughout the entire interactions that we have, it's very, very rare that these young people are on their own. They almost always have someone there with them for support, maybe a whānau member, often a mama or an auntie. Sometimes it's a social worker who's bringing them in because they've not got that whānau support. And that's a really key part of what we do is not just taking that individualized approach with the young person, but looking at who else is sitting around them, who else is their support. So we receive referrals in from anywhere. It could be general practice, it could be well child services, might be social agencies, it's often social workers, or we accept self-referrals also. Just want to highlight that navigation into a continuity of care midwifery arrangement is really key. And the reason why that's so important is the next bit around protecting the mana of that young mama, the face-to-face interactions, allowing time and a safe space to build a relationship, to engender trust with the care that they're receiving is really important. So we meet with them first. We then find an LMC midwife who is going to be a good match for them, and then we follow up with both the midwife and the young parents afterwards to make sure that that care arrangement is actually working and meeting their needs. And then there's that wider manaakitanga, which looks at the other support linkages that they might be in need of, things like housing, education, income, mental health support. Often we find with these young parents, they don't actually have their own transport, and they may be in need of a midwife who can do home visits for them, and actually they're often transient as well, so where you see them at one gestation might be different at the time you get to the next visit. So having that flexibility around how the care is delivered is key. And so just finally, I wanted to share with you a snapshot of who we're dealing with at this Young Parent Support Service. So this is really just capturing from an ethnicity perspective where we're seeing the majority of these young parents. And what I think is really interesting here is just to have a comparison with the young parent population and the wider Canterbury birthing population. So we're dealing with 36% of our work is with young Māori mama, whereas Māori mama on the whole represent 13% of the Canterbury birthing population. So you can see that there's a much higher number coming through our service, and the same with Pacifica. Yeah, so I think that ties in with some of the other things that you're talking about today, that we get it right for these young parents as early as we possibly can. So yeah, tēnā koutou katoa. Thank you all very much. It's lovely to be with you today.
Thank you, Violet. When I introduced you, I said that you're focused on developing innovative solutions together with the community, and your presentation is evidence of this. So thank you for your presentation and for almost literally picking up a PMMRC recommendation and making it happen. So thanks.